Okay, welcome back. So in today's session, we take very small topics of community medicines, and the name of topic is a stroke. So what is the meaning of this strokes? A stroke, it is a neurological manifestation due to the either there is a blockage in cerebral blood vessels. So when there is a blockage in cerebral blood vessels, we call it as ischemic strokes. Or another hand, it may be there is the rupturing of cerebral blood vessels. So when there is the rupturing of cerebral blood vessels, it is called hemorrhagic strokes. So two types of strokes, either there is the ischemic strokes due to the obstruction in cerebral blood vessels, or the rupturing of the cerebral blood vessels. So these are the meaning of strokes in a simple term. So what are the definition of strokes? It is the sudden onset of the neurological manifestation, I mean a neurological dysfunction. What is the sudden onset? Okay. So the sudden onsets of the neurological dysfunction caused by the interruption of blood supply to the brain, I mean a brain. So how this interruption of blood supply to the brain will occur? It is either due to the blockage of the cerebral blood vessels cause ischemic strokes, or the rupturing of the cerebral blood vessels leads to the clot formations called hemorrhagic strokes. So there are two causes of the strokes, either there is the blockage or there is the hemorrhages at the level of cerebral blood vessels. So what are the signs of a stroke? The signs of a stroke include coma, hemiplegia, paraplegia, monoplegia, and a speech disturbance. So these are the common signs of strokes. And what are the risk factor of the strokes? The hypertension is the main risk factor of the stroke. So it causes the cerebral thrombosis, and if there is the thrombus formation in the cerebral blood vessels, it causes ischemic stroke. So other risk factors include the left ventricular hypertrophy, diabetes, dyslipidemia, smoking, etc. So stroke control program for the prevention of strokes. So how we prevent the strokes? We basically prevent the hypertension, because the hypertension is the main cause of a stroke. So how we prevent the hypertension? Because most of the hypertension patients, they are the asymptomatics. So if a patient in a asymptomatic stage, they not visit the hospitals. So what we do to prevent the stroke, I mean to prevention of the hypertension, we basically go for the active surveillance. Now we measure the blood pressure of the patients. If their blood pressure is elevated more than 140 mmHg, we consider a hypertensive patient and start medication. We ask patient type verification. If there is in our type of type verification, definitely we go which we can prevent the hypertension, I mean early diagnosis and the treatments. Second is the because of hypertension, and little bit understand the come back in new series.